This episode is brought to you by LifeLock. Cybersecurity Awareness Month is still going strong, and LifeLock is here with a message about phishing, the scam cybercriminals use to trick victims into allowing access to their devices so they can steal their personal info. Being aware of phishing scams is one way to help protect yourself. For comprehensive identity theft protection, there's LifeLock. Start protecting your identity today with a 30-day free trial at LifeLock.com/podcast.
We're in the middle of our fall campaign. Thanks to those of you who have already made the leap to support our show. If you haven't yet, we've got more information for you later in the episode. Today on CityCast Denver. Most major cities have what's called a safety net hospital, a place where people can go when they're sick or hurt and don't have the means to pay. But here in Denver, our safety net has got a $155 million hole in their budget. So I'm sitting down with Denver Health CEO Donna Lynn to talk about why hospital leaders want you to vote for a tax increase to shore up their finances. Today is Thursday, October 17th. I'm Bree Davies, and here's what Denver's talking about. Donna Lynn, welcome to CityCast Denver.
Great. Thank you so much for having me.
So for years, I've been reading about how Denver Health is in the middle of this huge funding crisis, a quote, death spiral. I want to start there. Why is this happening?
Well, first of all, Denver Health is a safety net. What that means is literally sort of what it sounds like. We catch a lot of people in our state, and certainly the majority in the city, who often don't have the ability to go to other hospitals or healthcare systems. They're uninsured, or they have Medicaid, which often doesn't pay us the full cost of what we need. We've seen two things accelerate since COVID. One are healthcare costs, paying salaries for many healthcare workers who remain because many left after a couple of years of COVID, increased pharmaceutical costs and other medical costs. So on the cost side, we've seen some big increases, but we've also seen an increase in the number of uninsured patients in the last couple of years. So it's been dramatically different since 2020.
Let's talk about that. Is this a pandemic-birthed problem, or did the pandemic just make it worse? Or,
well, first of all, I sometimes describe Denver Health's finances as a roller coaster, meaning we might have a good year, then we have 2 bad years. We might have another good year, we might break even, but it's never been one where we've been able to build up significant reserves. And reserves are important to protect you from a rainy day or some unintended consequences. And we also just can't invest in our physical plant like some other healthcare systems can. And that's why you want to build up some of those reserves. I like to say we're victims of our own grit, which means we tighten our belts. We take on new responsibilities. We don't always have the money to do it, but we know it's the right thing to do. And I'll give you a great example. Starting this year, we now have 34 apartments that we provide to our patients post-hospitalization. We don't get any money to do that, but we know it's the right thing. We do it partly because we know sometimes we're discharging people to the streets. And if we do so, they also will not get better and might end up back inside the hospital walls. So giving them 30, 60, 90 days, up to 90 days is way better for us to avoid them getting sick again. But there's no reimbursement for it.
So I'm trying to picture how dramatic is this, the scale of this problem? Like we're kind of talking vaguely about it. What does it really look like?
Sure. Let me give you some numbers to chew on. So our budget is $1.4 billion for this year. And it's been going up since 1996. There's a reason why I'm going to draw that, that date in your mind. So that gives you some context of our size. $1.4 billion for the entire system, outpatient and inpatient care. But in 2024, we're going to provide $155 million, so a little more than 10% of our budget, in what we call uncompensated care. People are uninsured or people who have Medicaid where Medicaid doesn't really pay us what we need. So we have a budget problem of $155 million to try to solve this year. The year before it was 140. The year before it was about 120. So there's no revenue for that. There's expenses, but there is no revenue. So what do? We try to get money from the federal government. That's fairly small. We did get some money from the state, just $5 million this year. And we get $30 million a year from the city. So if you subtract the 5 and the 30, right, that's 35 from the 155, we still have a $120 million problem.
So let's get to why I'm talking to you in the first place, right? I want to know, how did you all get to this idea of putting a sales tax hike on the ballot this fall?
It's a great question. I've been at Denver Health for 2 years, and I came in thinking somehow I could be persuasive and I could get some of our elected officials to say, look at the great job you do. Look at all the people you take care of in our neighborhoods. Look at how you address behavioral health, substance use issues. Look at how you deal with the unhoused. And of course, we all know there's an intersection between people who are homeless and healthcare. So I was convinced that I had the power of persuasion and that the data would speak for itself. But since 1996, and I want to go back to that moment, that's when Denver Health separated from the city. We were a city agency, just like the police department or the fire department. And
so you were part of the budget.
Exactly. We were part of the city's budget. So right now you hear the mayor talking about his $1.7 billion budget. And we were part of that. But the mayor at that time, Mayor Webb, who was a great supporter of Denver Health, said to the person who was in my role, there's a lot of things that don't make sense about being a city agency. We have all these procurement rules. Denver Health is buying, high-cost pharmaceuticals, hiring neurosurgeons. So at that point, the city and Denver Health separated amicably, and there's an annual agreement that we negotiate every year with the city, and we ask the city for money to help us with these indigent patients and to recognize that unlike every other hospital, we take everybody. We don't turn people away. That money hasn't increased. In fact, if you're an economist, in real dollars, it's actually gone down over the last 26 years. So I knew something was amiss when I first came to Denver Health because I saw this chart somebody cleverly created. And then I asked the question, well, what's been happening? I know what's happening on the revenue side. What about the expense side? And that's when I saw what we call the proverbial hockey stick, particularly since 2020. So I said, there's something wrong here. What we then started doing was talking to other safety nets around the country. And we learned that they get about 11% of their revenue from their local government. We only get 2.4% from our local government. So that took us on a journey to do some polling, ask voters what they thought of Denver Health. Did they understand what we do and how essential we are to the city? And then to propose whether or not they would support a sales tax increase or a property tax increase to help Denver Health out. And the answer was they preferred a sales tax versus property tax.
Interesting. Do you feel like that 1996 decision was a bad decision?
I have great respect both for the mayor and the CEO of Denver Health at that time. But I think we didn't have a cost of living adjustment built into the language. I think it was too easy for various administrations to say, oh, we've got other problems. Maybe it was the recession of 2008. Maybe it was the boost that we got from the Affordable Care Act. I think a different agreement should have been negotiated, but now we're where we are. Mayor Johnston last year in his public testimony on our budget said, Donna, your problems are too big for us to solve.
So I want to ask you something because you're the face of this conversation, obviously, but also I read that you put at least $60,000 of your own personal money into backing this campaign for the sales tax increase. So you're the biggest individual donor to this campaign. And I've seen reports about you personally propping up the hospital's finances over the last few years. Why is this so important to you personally?
Well, actually, I put $80,000 into I wrote
That's a lot
another
of money.
check. I wrote another check 2 weeks ago. Well, first of all, when you have to raise money, and we have to raise money because we're a governmental authority. So Denver Health itself can't put money into the campaign. And we're running a campaign that requires a campaign manager, yard signs, advertising, all those kinds of things. So we have to raise that money. And I thought before I start asking people or organizations for money, I ought to lead and do what I can do. I really believe that Denver Health is essential to the economic and social vitality of this city. And I'm very committed to Denver and Colorado. I love the public sector. I've spent 23 years working in government, and I can't tell you the individuals that I see at Denver Health who work with patients every day. I'm just not sure how they do it. My job is to be their champion and be their leader. I'm not a clinician, so I've never had that direct experience, but I see what they do every day, and it's very humbling.
Do you think you'll stop having to put so much of your own money in if this sales tax is approved?
I hope so. But it's important to me that we thrive as an organization. And in addition to what we call our healthcare heroes, they deserve pay that's market competitive. We should be building new buildings that give a message to our patients that they're not second class in any way. And I think sometimes our belt tightening hasn't allowed us to do some of those things. And everybody deserves health care. It isn't just about health cares for rich people. It should be for everybody.
Oh, it's such a clutch off-season pickup, Dave.
I was worried we'd bring back the same team.
I meant those blackout motorized shades.
Blinds.com made it crazy affordable to replace our old blinds.
Hard to install?
No, it's easy. I installed these and then got some for my mom. She talked to a design consultant for free and scheduled a professional measure and install.
Hall of Fame son.
They're the #1 online retailer of custom window coverings in the world.
Blinds.com is the GOAT.
Shop Blinds.com right now and get up to 40% off select styles. Rules and restrictions may apply.
With Ring cameras and doorbells, it's easy to keep every fright in sight. See who's there. Keep your scaredy cats company.
Oh, it's okay, sweetie. I'll be home soon.
And protect your crypt from the real monsters.
Oh, come on. The sign says take one.
Find dead simple ways to stay connected right now at Ring.com.
Before we get back to my conversation with Denver Health CEO Donna Lynn, I want to remind you that our fall membership campaign is happening right now. So if you've been enjoying our show and want to help us keep bringing you the best of Denver, becoming a member is the best way to do it. It's true that our daily podcast and newsletter are completely free for anyone in our community, but that's only possible with member support. If we've ever helped you understand a local issue, hosted a guest you loved hearing from, or introduced you to the best of what's happening around town, now is the time to show your support. One of the best parts about this job is that I get to ask powerful people in the city important questions. We regularly get the opportunity to sit down with Mayor Johnston and talk to him about housing issues, the newcomer situation, the changes on Colfax, and the questions you, our dear readers and listeners, want us to ask. Since launching CityCast Denver way back in 2021, we've made it our mission to cover local politics in an accessible, fun, and interesting way. When the people in power are making big decisions for the Mile High City, we are right there to ask the tough stuff. So again, joining our member community is the best way to support our local daily podcast. With your small monthly contribution, we'll get to stick around for years to come. And anyone who signs up gets access to our podcast ad-free. Just visit membership.citycast.fm to become a member today. That's membership.citycast.fm. Thanks. So this is a big ballot this year. The Denver Health proposal is not the only sales tax hike on the ballot. The mayor's also proposed an increase to fund affordable housing. Together, if they both pass, Denver sales tax would be at 9.56%. I've heard a lot of grumbling from people about that. I'd love for you to speak to them directly. Like, why should we all pay more for Denver Health to exist?
First of all, we saw almost 175,000 patients who live in Denver last year. That's a significant part of the population. The second is the things that we do touch so many lives, including, as I said, young people who are in high school, who are struggling with mental health issues, substance use issues, and reproductive issues. If those young people don't graduate because they're not getting care, we have a problem from an economic perspective, potentially from a criminal justice perspective, but we want them to be contributing citizens in Denver. Hopefully most of them stay here, but to neglect them, they're not going to be able to get health care oftentimes outside of the schools themselves. It's convenient, it's free, we don't charge them. And supporting that system is very important. I know that the other side of it is, a sales tax, that doesn't feel right. You know, Elon Musk and you and I will pay the same sales tax if we go and want to buy something. The good news about sales tax is we've recognized that some of the basic necessities in life are exempt from the sales tax. So food and fuel, medications, all of those categories. When I got the polling results back, and we've actually done several polls to look at property tax versus sales tax, I was surprised that the sales tax kept polling better. And I think a lot of people have seen property taxes go up in the last several years at a rate that they didn't anticipate, and hence the support for the sales tax.
But you kind of brought up this point, though, whether it's Elon Musk or me and my neighbors, we're paying the same. But I could see where someone would say, well, that's still regressive. That's still harming lower income folks more than higher income folks, which property tax might be seen as differently.
Yeah, I totally agree. I mean, sales tax, as we all know, is regressive. I think what makes ours unique is the number of people who benefit from Denver Health. So think about 175,000 people. That's almost what we need to pass this measure. So if you got care at Denver Health in the last year, and again, you may not understand healthcare financing, there's a piece of what you've gotten that we're asking you to pay back in the form of a tiny increase in the sales tax. Now, I know the number sounds big, 9.6%, but it's 3.4 cents on a $10 purchase.
Let's talk about the deficit that you had mentioned, because, or maybe that percentage, like, honestly, is it enough? Because you told a city council committee earlier this year that your proposed sales tax hike would generate $70 million per year. Yet in September, hospital officials told city council that Denver Health is on track to be in this $155 million deficit you've been talking about. So why not ask for more from voters?
The sales tax increases that have passed in recent years have all actually been lower than what we're asking for. We did poll that. We polled 0.34. Honestly, I didn't have the audacity to go higher. So I thought 3.4 cents was a victory. And we still get the $30 million from the city. And I'm hoping both the state and the feds step up. And we'll still do what we always do, is try to be efficient, try to improve our operations so we can squeeze some things out of that $155 million that we see.
So do you think the mayor's affordable housing tax will pass? Like, it's more.
I don't have a crystal ball. I would just say I'm gonna be a little safe here and say our initiative benefits directly 174,000 people that live in Denver. And the difference between ours and 2R is that if we don't win, there are dire consequences. If the mayor's doesn't pass, there just aren't the same kind of immediate dire consequences, as important as affordable housing is to so many people.
Well, I have to ask you, so former President Trump has been talking about Denver Health. He mentioned you all indirectly, or last Friday at his rally.
Emergency rooms in Denver, beautiful Denver, have been, think of this, 6,000% increase in patients. 6,000% increase. You're not going to get a room, when you go to hospitals, you're not going to get a room. Someday you don't know it because you hopefully won't need a hospital. But if you do, you're not going to be able to get in. They come in from Colombia, from Honduras, from Ecuador, from Venezuela. A hospital only 15 miles outside Aurora has been overwhelmed by 20,000 visits from illegal aliens, costing the hospital over $10 million, and those costs are being passed on to you directly.
Do you have any response?
Well, I believe that facts are really important. And yes, has Denver Health seen migrants? Yes, this year, last year, probably for many, many years. And so have other healthcare systems, because quite frankly, we need to be compassionate about fellow humans who actually, in most cases, come here and are very productive citizens. And there's a lot of evidence about that. We also don't want people coming who haven't been immunized. Once a migrant is in Denver, we want to make sure they're healthy and they're immunized and they aren't, facing communicable diseases that could impact everyone. And we certainly don't want people dying or giving birth in a campsite. So we do provide care. The truth is, the care that we have provided to migrants in the last year is about 2% of the total visits that we provide to people who live in Denver or who live in the surrounding counties.
I grew up here, and I have to say, Denver Health was Denver General when I was a kid. There was this book that came out, The Knife and Gun Club. I wonder, does Denver Health just suffer from a PR problem in the sense that people don't know it's a place that you can go for routine care? It's not just for folks on the margins not to say that they're a problem, but it's not just for folks in this emergency state or unhoused folks. It's for anybody. Do you think people just don't know that?
I think they don't know. First of all, I get all my health care at Denver Health. And so do many of the people on our board of directors. All the mayors have gotten their health care at Denver Health. In fact, when Mayor Pena spoke yesterday, he talked about 4 surgeries that he's had at Denver Health. I think there's a couple of other things that we suffer from, so to speak. First of all, people think we're a hospital. That's all they associate it with. And so the level 1 trauma, which is a great thing.
Which is incredible.
That's where you want to go.
My brother
exactly.
Saved my brother's life.
And so there's a mental map that in extreme incident, you go to the emergency room, you get great care. But to your point, it isn't so much a perception that there's a clinic in a community, and I should go there for routine care. I should go there for immunizations and the like. But I think there's some old maps. But again, location matters. And we've been, because of our mission, we have been predominantly in areas, lower income areas.
So one last question. What would happen to Denver Health if Denver voters say no to this new tax?
The first step is that both the city council and the mayor have agreed to re-engage with us. So the mayor and the council said we'll reopen the budget. Now, when they say we'll reopen the budget, that means money has to come from someplace else. So cuts in another agency. I am not optimistic that in any large scale that would happen. So we're counting on $70 million in revenue for 2025. If we don't get it, we're going to cut services. And I say that with a hole in my heart and my stomach. But we have to shrink to get stronger. And I'm committed to do that because we've got to invest in our people, in technology that is state of the art, that brings great care to everybody. So we are likely to reduce hours, perhaps, in some of our clinics, which means people will wait longer to get health care, or they'll just not get health care. And I think that's a tragedy. And that's why I'm so personally committed to supporting the initiative, getting the word out, and getting the kind of endorsements that we've gotten that come from, one might argue, the right and the left.
Donalyn, thank you so much.
Thank you. Appreciate it.
And a reminder that our fall campaign is underway. Become a CityCast Denver member and get good feelings and great perks. Go to membership.citycast.fm right now to join. If you're already a member, thank you. We couldn't do this work without you. That's all for today here on CityCast Denver. If you enjoyed this show, why not take a minute to tell former Mayor Wellington Webb about us? Rate the show wherever you get your podcasts and subscribe to our morning newsletter and learn more about us at denver.citycast.fm. We'll be back tomorrow morning with more news from around the city. See ya.